案了，就是一个多个方向通道来解决这个黑漫场的这个不均性的问题。那么像机翼，现在他们有推出像出放这个，因为3T 它做心脏和还有很多挑战啊，做过的都知道，有的时候做的还不一定比较好。问题，当然问题非常多。我自己 I will translate for myself.
Yeah, it would be great to start a program in China, here in China, and I could help do it. It might be easier than the United States.
Okay, thank you.
For spectroscopy.
The first part producing compared with MRS, which one is more sensitive for behavior mechanics?
That's a good question. The study hasn't been done yet, but from my perspective, the perfusion study with a range, we don't see that pattern very much, and I always worry that pattern is an artifact. Probably shouldn't say that. There's an artifact called a dark ring artifact, or dark rim artifact, that happens at 3 Tesla, or 1.5 Tesla, and it gets better at 3 Tesla. So we're doing these studies now at 3 Tesla to see if we still see the dark ring or dark rim artifact. The spectroscopy is hard to fool it. I think it's quite reliable when it's positive, but it's less reliable when it's negative. So the possibility of having false negatives is fair, and the possibility of having false positives is low. So I think it's a good technique. At 3 Tesla, it works extremely well. So the signal to noise, the ability to see those peaks, is really good. I'm sure it's even better at 7 Tesla because those aren't so sensitive to the motion. What they are sensitive to is something that might destroy the homogeneity of the magnet, like if the magnet happens to be in a garage or above a garage, cars are driving underneath, it would be impossible to do that kind of study.
他还是在讲他说的这个场越高啊，他这个 artifact 这个回流越多，所以他讲在现场讲呢，说他自己没有做 TT 的研究，他的小组他们有3个研究组，其中有个研究组是用这个 TT 研究的。然后刚才夏教授问一个问题是怎么，我觉得他没有回答这个问题。夏教授问的意思呢，就是波谱分析和灌注这2个字更特一些，所以但是他好像并没有回答这个问题。
So we're going to just take a 10-minute break. And first the question is, what is CH? Oh, we don't have it. Very clean. How much does he?
先介绍一下这个，刚才提的时候，他说什么是 CHCDP。
So we're talking about the semi-automated program at CHCDP, and the questions are: what is CHCDP? What is the analysis software? What services does it represent? And what are some examples?
他下面就要讲这个半自动这种的这个方法来评价其他功能，就是所谓这种 CHCDP 这个项目。他下边要讲这几个问题，一个是什么是 CHCDP， 另外一个呢就是它这种分析软件，再一个就是这种网络工作这个分析服务，再一个就是数据的采集与比较，采集结果的这个比较。
So basically, CHCDP stands for the. I wondered what it stood for when I first heard it too.
实际上它是这样，就是 CDP 的就是这么一个缩写，就这几个字母打头，就是加 加州心脏中心这个小五项这么一个这几个打头，组成这么一个。
But it stands for California Heart Centers Group. So CHCGP. Maybe it should have said China Heart Center. It is developing, CHCGP is developing special software to rapidly assess, pardon the spelling here, cardiac function, perfusion, and viability. And it will work with physicians and hospitals to diagnose persons with disease detected by its advanced imaging approaches.
就是它这种他们研发的这种特殊的软件，用来快速的评价心脏功能，这个心肌灌注和这个心肌的活性。另外呢，他们还将与这个内科医生以及医院来合作，对这个个体病人以及他们所患的这个心脏疾病，采用这种高级的成像方法来进行评价。
The approach is available online through an FTP site, allowing you to input your patient's data, CMR data, and it will then be analyzed by the computer, and then the results will be available to you soon thereafter.
他就说通过这个网络系统把这个病人的资料通过 FTP 这种形式给传回以后呢，很快就返回来结果。
So the software allows use of all types of image formats, which includes of course DICOM, JPEG, and GIF. It has a very user-friendly interface that enables easy access, and it's very easy to learn virtually intuitively, and it generates cardiac functional and imaging results very rapidly. This is the kind of screen you might see, but because it's so little, it's going to be difficult for you to tell how really easy and elegant it is.
它这个软件呢，它支持各种类型的一些图像，包括咱们常用的DICOM格式，也支持呢，像JPG 格式，还有这个 GIF 格式也都支持。另外呢，它的界面是很友好的，能够保证比较容易的应用分析和比较快的学起来比较快。再一个呢，它就可以很快的来这个产出这种心脏功能的结果。他说这些图像都比较小，就没法来详细说怎么容易了。
We spent a long time analyzing data to generate function images from the function images, and to get a myriad or numerous that I'll show you a list of in a moment. But when and if we can use a computer approach for this purpose, it will allow not only time saving, but also allow reproducible kinds of imaging results. Not imaging results, but results of numeric results.
他说过去我们做这个心脏功能分析花费了太多的时间，那么现在这个软件呢，不仅可以使我们节省时间，同时呢，使我们这种结果的可同步性能够有很大的提高。
We also have added to it a component that attempts to automatically come up with a diagnosis or a set of diagnoses. So if the computer sees a ventricular aneurysm, one segment, let's say the apex, that's dyskinetic and is aneurysmal, it will say, of course, ventricular aneurysm, coronary artery disease. If it sees that the entire LV is dilated, is diffusely hypocontractile, it will say suspect cardiomyopathy. If it sees that both chambers, RV and LV, are both dilated and hypocontractile, it will say it with a greater degree of certainty.
这个局部的这个功能，好像他说的是，好像说局部的功能那种，比如说像磁力流啊，这个你相对来讲比较好诊断。但是要整体心脏的这个整个心脏的扩大，这个相对来讲诊断就困难一些。我刚才没有太抓住全部说的话，但是好像就是这种意思。
It will use wall thickness to detect hypertrophy. It will use distribution of wall thickness to detect hypertrophic cardiomyopathy. It will use information about the appearance of jets from valves to indicate valvular heart disease and which valve. And we're now working on approaches to make diagnosis of congenital and then from there complex congenital heart disease as well. It's not difficult. It just takes a lot of engineering time to do this. So it's a work in progress, but a lot of it is now very much available. Particularly the focus on the ability to generate a considerable amount of information from each study already. And I'll show you that in a moment.
还说这个软件是好，这块。
You use the congenital heart disease. It's not available. I should be is same.
Simple. Not complex.
No,
like,
there are a couple of the papers you can available for congenital heart disease and or yeah, myocardiopathy.
But atrial and ventricular septal defect.
Navarro disease of the cardio.
Yeah, valvular.
他不是，他在讲是这样，他现在主要用来心肌缺血，但是呢，他现在还要做更多的工程去解决几个问题，一个是心肌病还有一个是先天性的疾病，还有瓣膜病。他这部分呢，他在做，他说这个问题没什么问题，因为他们都是差不多的，但是他现在呢要解决这个问题，他很快他会解决这个事情。
So we can also generate the kind of bullseye plots that provide you with the severity of perfusion deficits as well as especially wall motion abnormalities on a region by region basis.
休息，进行休息，可以。用这个浏览图来进行评价。
So here are some beating hearts. These may be yours, not your heart, but your patient. Not sure where they came from, but you can see that the studies that we receive from China are extremely good quality. In many cases, better quality than we generally receive from the United States. Probably your technologists and you have a knowledge of this imaging procedure that is excellent, and we're very happy about the quality of the images that we've seen so far. So we would generate, we would see 2-chamber, 4-chamber, and short-axis images, for example.
刚才讲这是一个咱们中国人做的一个影像，它有的图像表达是很好的，那就是一个长轴位、自相行为和短轴位的一个影像。
And again, we enhancement images. That helps with the diagnosis. We like your perfusion images. That